Welcome to the Psychology and Physical Training channel, Introduction to Somatoform Disorders. Have you ever wondered, what are somatoform disorders? Well, let's dive into this fascinating topic. Somatoform disorders, in the realm of psychiatry, are a unique category of disorders. They're characterized by physical symptoms that resemble those of a physical disease or injury. Now, here's the twist. There are no identifiable physical causes for these symptoms. That's right. Despite the physical manifestation, these disorders are not due to any physical illness or injury. Think about that for a moment. This means that the root of these disorders lies not in the body, but in the mind. The mind, with its vast and intricate network of thoughts, emotions, and perceptions, can create physical symptoms that are so convincing they can mimic physical diseases. So, somatoform disorders are essentially physical symptoms with psychological roots. Interesting, isn't it? Symptoms of somatoform disorders. Now that we know what somatoform disorders are, let's explore their symptoms. Somatoform disorders encompass a wide range of symptoms, but what ties them together is the common thread of physical symptoms that can't be explained by any known medical condition or substance use. And yes, it's essential to remember that these symptoms are real, not imagined or faked. Let's start with pain. People with somatoform disorders often report experiencing pain that lacks a clear physical cause. This could be widespread, or it could be localized to specific areas like the back or the head. The intensity and duration of the pain can vary widely, but it's always severe enough to interfere with daily life. Next, we have neurological symptoms. These can mimic those of a neurological disorder like seizures or paralysis, but without any detectable abnormalities in the nervous system. Individuals might also report symptoms such as difficulty swallowing or loss of voice, which again can't be traced back to any known medical condition. Gastrointestinal complaints are another common symptom. Patients may experience difficulties such as nausea, bloating, vomiting, or diarrhea with no identifiable cause. In severe cases, these symptoms can lead to significant weight loss and other health complications. Sexual symptoms are also a part of the somatoform disorder spectrum. These can include symptoms like erectile dysfunction in men or pain during intercourse in women without any evident physical cause. Lastly, there's pseudocyesis, a rare but fascinating symptom where an individual may believe they're pregnant, even displaying signs such as a swollen belly or missed periods, but without actually being pregnant. What's crucial to understand here is that these symptoms aren't just all in the head. They're genuine experiences that can significantly impact a person's daily life, causing distress, and often leading to difficulties in social, occupational, or other important areas of functioning. Despite being physically unexplainable, these symptoms significantly impact a person's daily life. So, recognizing them is the first step towards understanding and managing somatoform disorders. Types of somatoform disorders. There are several types of somatoform disorders. Shall we delve into them? Let's begin with somatization disorder. This is a chronic condition in which individuals experience a wide array of physical symptoms without a clear medical explanation. These symptoms could range from pain to gastrointestinal issues to sexual complaints. It's like the body is speaking a language of distress, but it's all rooted in the mind. Next, we have conversion disorder. This intriguing disorder presents with symptoms that mimic neurological conditions such as paralysis, seizures, or even blindness. What's peculiar is that these symptoms don't align with known neurological pathways. It's as if the brain is converting psychological distress into physical symptoms. Then there is pain disorder. As the name suggests, individuals with this disorder experience persistent and severe pain that seems to have no physical basis. The pain is very real to them, but it's thought to be a manifestation of psychological stress or trauma. Moving on, let's talk about hypochondriasis, or what's now more commonly referred to as illness-anxiety disorder. In this condition, individuals have a preoccupation with having a serious illness despite having no or only mild symptoms. They misinterpret normal bodily sensations as signs of a grave illness, causing them significant distress. Finally, we have body dysmorphic disorder. This disorder is characterized by an obsessive focus on perceived flaws in one's physical appearance. These perceived flaws are often minor or not observable to others. But to the individual, they can feel extremely prominent and cause a great deal of distress. So there you have it. From somatization disorder to conversion disorder, pain disorder, hypochondriasis, and body dysmorphic disorder, these are the primary types of somatoform disorders. Each brings a unique set of challenges and each manifests psychological distress in a physical form. Each type of somatoform disorder is unique, yet they all center around physical symptoms with psychological origins. Etiology of somatoform disorders. But what causes these somatoform disorders? Let's find out. Firstly, it's important to note that the exact cause of somatoform disorders is unknown. However, researchers believe that a combination of several factors contributes to the development of these conditions. One of these factors is genetic and biological influences. Some studies suggest that people with somatoform disorders may have a genetic predisposition to the condition. This means that if a close family member has a somatoform disorder, you might be more likely to develop one too. In addition, some biological factors, such as an overactive nervous system, could make a person more susceptible to these disorders. Personality traits are another potential contributor. People with certain personality traits, such as those who are highly sensitive or have a tendency to avoid problems, might be more prone to developing somatoform disorders. They may perceive physical sensations more intensely or react more strongly to physical symptoms, leading to an increased focus on bodily sensations. Learned behavior is another key factor in the development of somatoform disorders. For instance, a person who grew up in a family where illness was a common way to get attention or avoid responsibilities might learn to express stress or emotional discomfort through physical symptoms. And speaking of stress, it's a big player in the onset of these disorders. Major life stressors, such as the loss of a loved one or a traumatic event, can trigger the onset of somatoform disorders. Chronic stress, too, can lead to physical symptoms as the body's way of signaling that something isn't right. In many cases, these factors interact in complex ways to contribute to the development of somatoform disorders. For example, a person with a genetic predisposition might experience a major life stressor, leading them to develop symptoms. While the exact cause of somatoform disorders remains a mystery, several factors likely play a role. Treatment of somatoform disorders. Treatment for somatoform disorders is crucial. Shall we examine the options? When it comes to treating somatoform disorders, it's important to remember that there isn't a one-size-fits-all solution. The treatment plan must be comprehensive and tailored to the individual's specific symptoms and needs. Cognitive behavioral therapy, or CBT, is one of the primary treatment methods. It's a type of psychotherapy that helps individuals become aware of inaccurate or negative thinking so they can view challenging situations more clearly and respond to them in a more effective way. In the context of somatoform disorders, CBT can help individuals to understand the interplay between their physical symptoms and their emotions, thoughts, and behaviors. Medication can also play a role in the treatment of somatoform disorders, although it's not typically the first line of defense. Antidepressants or anti-anxiety drugs might be prescribed to manage any underlying mental health conditions, such as depression or anxiety, that may be exacerbating the symptoms of the somatoform disorder. Stress management techniques form another crucial part of the treatment plan. Regular exercise, adequate sleep, and a healthy diet can all help to reduce stress levels and improve physical well-being. Mind-body techniques such as yoga, meditation, and deep breathing exercises can also be beneficial. In addition to these primary treatments, it's essential for the individual to have a strong support system in place. This could include friends, family, or a support group of people who are going through similar experiences. This support system can provide emotional comfort and practical advice and can also help the individual to feel less alone in their journey. Remember, the goal of treatment isn't to eliminate physical symptoms that don't have a clear medical cause. Instead, it's to help individuals manage their symptoms, cope with the distress they're causing, and improve their overall quality of life. With the right treatment, individuals with somatoform disorders can lead fulfilling, productive lives. Overview. Somatoform disorders. Let's quickly recap what we've learned about somatoform disorders. These are psychological disorders characterized by physical symptoms that cannot be traced back to a medical condition substance use, or another mental disorder. The symptoms, varying from pain to neurological issues, can be debilitating, even though no physical cause can be identified. The types of somatoform disorders include somatization disorder, conversion disorder, pain disorder, and hypochondriasis, each with its unique presentation and challenges. The etiology or cause is often a mix of psychological and biological factors, and it's important to remember that these disorders are not simply a product of imagination or malingering. Treatment typically involves a combination of cognitive behavioral therapy and sometimes medication, with the goal of helping the individual manage their symptoms and improve their quality of life. Remember, somatoform disorders are not all in the head. They are complex disorders that require understanding and compassionate care. And if you like this video, do not forget to subscribe to the Psychology and Physical Training channel for more videos. Thanks for watching.